Dietrich, Chairman of the Board of Health in Durham County, and welcome to the October 8th Board of Health meeting. Brian Wardell has advised us we're going to have to do roll calls, so let me do an attendance roll call vote, and then we'll get on to the business at hand. So I'll do this alphabetically. Dr. Brathwaite, Mr. Brown, Mr. Curtis.
Yes.
Commissioner Howerton.
Present.
Mr. Ireland. Eric.
Present.
Okay. Dr. Jackson.
I'm here.
Thank you. Dr. McDougall. Dr. Miller. Ms. Orto.
Present.
Dr. Rosenstein.
Present.
And Mr. Duke is here. So we have a quorum. I expect we'll have others joining us as we get going here. So we will do roll call votes for any of our action items. And I would ask that anyone making a motion or seconding a motion, identify yourself so Roz can have that for the electronic record. So let me begin by asking if we have any adjustments to tonight's agenda. Any additions or adjustments? Then I would entertain a motion that we approve the agenda as it stands.
Spence Curtis, so moved.
Thank you.
Second, Brenda.
Second.
Okay, we have a motion and a second. Any discussion? All right, we'll vote on this. Dr. Brathwaite, Mr. Brown, Mr. Curtis,
Yes.
Commissioner Howerton,
Yes.
Mr. Ireland,
Yes.
Dr. Jackson, Dr. McDougall.
I'm here.
Okay, thank you. Dr. Miller, Ms. Orto,
Yes.
Dr. Rosenstein,
Yes.
and yes, Mr. Dietrich. Thank you. So you received minutes from our August 13th meeting in your meeting packet. And so I would ask if there's any discussion or a motion to approve those minutes.
So moved. Brenda.
That was Commissioner Howerton.
Second,
Yeah.
Spence Curtis.
And Mr. Curtis, second. Any discussion? All right, we'll do a roll call vote on the minutes approval. Dr. Brathwaite, Mr. Brown,
Approved.
Mr.
Approved.
Yes.
Commissioner Howerton,
Yes.
Mr. Ireland,
Approved.
Dr. Jackson,
Approve.
Dr. McDougall, Dr. Miller,
Approved.
Ms. Orto,
Approved.
Dr. Rosenstein,
Approved.
and yes, by Mr. Dietrich. Thank you. Do we have any public comments tonight? Roz or Rod, any public comments?
No, sir.
Okay, thank you. Moving on to staff and program recognition agenda item tonight. Any staff or program recognition?
Yes, sir, Mr. Chair. I have several that I'd like the board to recognize. First and foremost, we want to say good evening to the board. It's been a while. Certainly enjoyed this new format where we get to see your faces and hear your voices at the same time. So again, on behalf of a very grateful board, grateful agency, we are thankful for our Board of Health. It's a pleasure for me this evening to introduce our newest addition to our executive leadership team, Ms. Liz Stevens, RN. She has been with Durham Public Health for quite some time, with the exception of a 5-year hiatus where she was still working with us, but not working for us. She hails from the great state of Vermont, and she has done quite a bit inside the Durham County Department of Public Health to include working inside our STI clinic, maternal health clinic, and school health program. Liz began her tenure as our Deputy Public Health Director on September 21st. And believe me when I say that she has hit the ground running. She has been instrumental in our COVID response, particularly heading up our long-term care facility or nursing home task force. This time I'd love for Liz to give you a few words, and then we'll begin to introduce some others. Liz, the floor is yours.
Thank you, Rod, and good evening, everyone. It's really an honor to be here as, like Rod said, part of the executive leadership committee here at the health department. I have called Durham home, North Carolina home for more than half my life at this point, and Durham has been home for much of that time. So as Rod said, kind of my home has always been here in public health. Gail and Cheryl, Scott, and others took a chance on hiring me straight out of nursing school about 11 years ago. And I think it's worked out well for everybody, myself first and foremost. So like Rod said, I look forward to bringing another nursing eye and clinical eye to the leadership team here at the health department. It has been a challenge and a privilege to be as involved as I've been in our COVID response. And I look forward to continuing to work with leadership and with the board to help balance, what we find ourselves tasked with, balancing the needs of our clients and our community, along with the needs of the staff and the needs of the county. I very much see my role as that bridge and look forward to what's next to come. So thank you.
Thank you, Liz. Glad to have you on board. As Chair, if I may, we have two additional very specialized positions. And for those introductions, I'll turn it over to our Division Director for our Health Education and Community Transformation, Mrs. Lindsay Bickersbach.
Good evening. Yeah, we have two positions that we have been working a long time towards, and we got a little bit interrupted by the hiring freeze that came on from our COVID response. But over the late summer, we were able to have two people join our team. First is Jay Stockett, and she is involved with our Ending the HIV Epidemic efforts and the Paris Declaration. So I will let her introduce herself and then come back to introduce the second. Jay, I think you're on mute still.
I apologize. I wanted to thank you very much and all the board members for this opportunity to speak with you this evening. And I'm very excited to talk a little bit about the program that I'm working with in alignment with the Durham County Health Department. As Ms. Lindsay said, my name is Jamale Stockett. I'm most known as Jay for short. I originally came to North Carolina from the Midwest by way of Ohio. I spent a little time in the United States Air Force, where I kind of fell in love with the idea of public health and communities. After that, I moved down to Durham and spent some time in Georgia, and then came back to North Carolina, and it's been my home ever since. My background is mostly centered in community program, community initiatives, and working with vulnerable populations, such as the LGBTQ community and people living with HIV, which is why I'm really, really excited to have been asked and been given the opportunity to work with the initiative that I'm currently working on right now, which is called the Fast Track City Initiative, also known as the 90-90-90 Initiative, which is a global partnership that combines 4 different global partners: the International Association of Provider of AIDS Care, the Joint United Nations on HIV, the United Nations Human Settlements Program on HIV, and the City of Paris. That initiative looks at targeting 3 goals at 90-90 and 90%. 90% of all people living with HIV will know that they have HIV. 90% of all people diagnosed with HIV will receive ART or be in some type of ART therapy. And 90% of those people diagnosed with HIV and on ART will be virally suppressed. I'm really excited to have been given the opportunity because Durham has done a lot of great work I've already had several meetings with our leadership, including Mr. Jenkins. We have some meetings that are upcoming later on this month and some next month, where we will talk more about this. But from the very beginning, I can speak with truth and sincerity when I say that we have garnered their support from the very beginning on all of these efforts. And I'm really excited to reinvigorate the program and to get Durham on track for achieving those 90-90-90 goals. Thank you, board, for your time.
Thank you.
Thanks, Jay. And then the other person that we've had join the Health Education and Community Transformation Division just a little bit more than a month ago is Jess Busquet. And she is in the role of our ACEs, that's Adverse Childhood Experiences, ACEs and Resilience Coordinator. And so similarly, I'm going to give Jess a moment to actually say hello to everyone, talk a little bit about her role, and then I'll wrap us up.
Thank you, Lindsay, and thank you all. It's great to meet you all virtually. Hopefully one day, maybe in person. I'm Jess Bosquet, and I, as Lindsay said, am the new ACEs and Resilience Coordinator, and I'm delighted to be here. I am a Northern Californian with Midwestern roots who has been on the East Coast for about 10 years now. Most of that time was spent in DC, working in federal international assistance policy related to child health and well-being for an international organization. And I moved down to North Carolina a couple of years ago to pursue my master's of public health and to really pursue better understanding of trauma-informed practice and care within the school system. And so I'm coming most recently from the Public School Forum of North Carolina and their Resilience and Learning Project, where I was working with a school in Duplin County on becoming a more trauma-informed learning environment and coaching and training teachers and staff on classroom practices and changes in the environment of the school, at least until March when we took that all virtually. So I am delighted to be here, mostly because I feel like I get to join an already amazing community of people doing ACEs and resilience work, and a community that's been doing this work for a really long time already. And as I've gotten to know some of our partners who are doing the work and have been a part of the Durham ACEs and Resilience Task Force, which I will be coordinating moving forward, hearing the work that they've been doing for more than a decade has been absolutely incredible. And so I know that I'm joining an already strong team of practitioners and really looking forward to supporting the work that they'll be doing. And so I'm now in my 6th week and sitting down virtually and talking to people and hearing about their work, but also how this role can best support them from the county side. Thank you.
Yeah, so a big welcome to both Jay and Jess. The thing I wanted to highlight the most, in addition to everything they shared about the specific projects they're involved with, is that we're really excited that this is that extension of health education beyond individual education to really thinking about how policies, how different systems, and how the overall environment influence the way that individuals experience trauma, clinical care, and public health overall. So these are 2 initiatives that we've been working on for a while, and we're excited to have really talented people on board to be able to do this work in an approach that's evidence-based and also really driven in those policy, system, and environment changes. So welcome on board.
Thank you, Lindsay. Thank you, Jay. Thank you, Jess, affectionately known as J squared. They sit right next to each other, so we just lump the J's together and say J squared. But we're really excited to have them on board, and we look forward, Board of Health, of reporting to you all about the great work that they're doing and the difference that they're making in our community. I just beg your patience for a few more minutes. I just want the board to know that we are in the midst of our North Carolina Public Health Association Fall Virtual Conference. And every year with NCPHA, we always have awards sponsored by GlaxoSmithKline, particularly the Child Health Awards. I'm proud to announce that our retired General Manager and Public Health Director, Gail Harris, was awarded the Lifetime Achievement Award She was recognized on today. That's an awesome accomplishment. We put forth that nomination, and she was the lucky winner. She sends her thanks, and she wanted to make sure that we recognize that she always had a very supportive Board of Health, and she thanks you all as well. So again, we're thankful for Gail's award, and also our former Deputy Public Health Director, Tara Blackley, was awarded an individual award. And special thanks to Michelle Easterling and several others who headed up that nomination. And particularly, we're thankful for our community partners, Michelle Lynn, Fred Johnson, and Phil Harewood, who thought it not robbery to compose a letter of support in her nomination. Money is the key. $4,000 will be in Gail Harris's name for some efforts around child health initiatives. And Tara Blackley received a nice parting gift. She gets $2,000 to do with as she pleases. So just want to mention that to you all. Mr. Chair, thank you for your patience, and I'll turn it back over to you, sir.
Okay, Rod, thank you. And we appreciate you sending those YouTube videos of those program announcements or winning announcements yesterday. It was very compelling. So that does for staff recognition. And let me digress for a second. We have Mr. Brown, since we did a roll call, has joined us. Mr. Brown has joined us. Dr. Miller, Dr. Braithwaite, and Dr. McDougall are all with us now that I can see on my screen. So I think we've got a full house here. Thank you for joining us tonight. In your packet, let's see, administrative reports and presentations. I don't think we have any. Rod, do you aware of any administrative other reports?
Not at the present, Mr. Chair.
Okay, thank you. In your packet, you also received the Public Health Vacancy Report, the Public Health NOV Report, and the Health Director's Report. And I would ask if there's any questions about any of those reports.
I guess I have one, if I may.
Sure, go ahead.
Just wanted to know if that vacancy, those numbers are getting any better. Are they beginning to go in the right direction or what?
We're doing our very best, Commissioner Howerton, to hold our own. But during public health, just like Lincoln and a lot of other healthcare facilities are really facing some challenges when it comes to COVID-19 and back to school, childcare issues. So we have had a number of individuals to resign for better opportunities that are more conducive to their family situations. We are constantly working with county HR just to see how we can best come up with alternatives to assist our staff with their childcare needs. And unfortunately, public health truly is on the front lines. Commissioner Howerton, in terms of our COVID response. And there's just some things that we have to do in order to protect the community. Some of these activities were not necessarily met favorably by some individuals, and they decided to go on to greener pastures. However, as I aforementioned, we're doing our best to make sure that we monitor the staff, make sure that they have what they need, and that we are able to be attentive to any needs that they may have now.
Thank you.
All right, Mr. Chair, with regard to the NOV report, we actually had a couple of those that resolved themselves between this meeting and the last meeting, which is good news. And there's one that may get resolved that has been lingering around for a few years. We actually have a judgment against the homeowner. And so we are reevaluating to see how to proceed with that at this point. But there's nothing else to report on the NOV.
Sorry, somebody needs to mute. I'm having a hard time hearing you, Mr. Wardell.
Yeah, somebody's radio or something's on.
Yeah. Okay, that's better.
Okay, so that is the status of the NOV report. So we are progressively going down the report and dealing with anything that's been out there for quite some time. So right now we're concentrating on 2005 Patterson Road, which may require an administrative warrant to go out and re-inspect that property.
Okay, thank you, Brian. And back to the vacancy report, I did notice that there were a number of the positions that were vacant did have start dates by a number of names on the list. So that was very encouraging. Do we need to take action on this, on the reports, or are they just received? We have to formally vote on them?
No, sir.
Okay, thank you.
They're just received, Mr. Chair.
Thank you. Okay, on to committee reports. We have two very important committees that we need to appoint tonight. The Personnel Committee is the committee that does our health director's evaluation, and Roz brought it to my attention this past month that he should have had a 6-month evaluation into his position. So we're a little behind the curve on getting that done. By virtue of our organization, our vice chair is the chairman of the Personnel Committee, and I serve as an ex officio member of the Personnel Committee, but we need 3 of you to join that Personnel Committee. What we do is send out a survey to people that our health director works with. It's already formatted. It's one we've used for a number of years. It's a questionnaire that folks get and an email back in. As a committee, you review the results of that survey, and then you sit down with the health director and have a discussion on strengths and weaknesses and things that they could improve. So it's really a 1-meeting event. You'll receive from Roz the survey. We will all get the survey as board members. Most of the staff of the health department will get the survey as staff, and a lot of the city government people that interact with the health director will get the survey. The results will be compiled. You'll have a chance to review them and then meet with the health director. It's a one meeting event. So I need 3 volunteers for the Personnel Committee.
This is Vicky Ordo. I'll volunteer.
Thank you, Vicki.
It's Brenda.
Curtis, I'll volunteer.
And Brenda, I'll volunteer.
Thank you very much. Did you get all those, Roz?
I've heard Otto, Howerton, and who was the last person?
Spence Curtis.
Okay, thank you.
Thank you for volunteering. Our second important committee appointment for tonight is the nomination committee. As of January will be my last meeting on the Board of Health, and I roll off the board after 9 years of being on the board.
Wow.
And we need a new chairman, and we will need a nominee for vice chair. And we need 3 of you to serve on a nominating committee to select who your nominees would be for chair and vice chair, beginning with the February 2021 meeting.
This is Mary Braithwaite. I can volunteer.
Thank you, Mary. I think you chaired it last year, didn't you?
Yes.
Thank you.
And Jim Miller here. I can volunteer.
Okay, thank you, Dr.
Jim?
Did you say yes, Brenda?
No, I wanted to give somebody else a chance since I'm on the other committee. Let somebody.
Okay.
Yeah.
I think Ms. Jackson's trying to speak.
Yeah, I'll
Jackson.
volunteer.
Okay, thank you very much.
I was just talking.
And I need one of you 3 to agree to chair the committee.
If Mary's willing, I nominate her.
I'll second.
I'd be happy to.
Okay. She accepts your nomination. So thank you, Dr. Brett. Okay, so we'll ask both of these committees to report back in December. We definitely need nominees who've agreed to run by the December meeting. I know plan right now to meet in December. I'm not sure if we're going to meet in January or not. So we're playing our meeting schedule by ear. So both of you, both of your committees could have results to us by the December meeting. That would be helpful. And Roz can help facilitate virtual meetings and organizing what you need to get done. So just be in contact with Roz to facilitate what it is that you need done. Thank you very much for volunteering.
Question,
Okay,
Steve.
yeah.
Once again, before we meet personnel committee, we need to wait on the results of the survey.
Right, you do.
And everyone has a chance to review them.
Right.
Very good.
Let me ask Roz to send the personnel committee the survey. We think it's good to go, but you guys take a look and make sure you're okay with it. It takes the material straight out of the health director's job description and ask each of those elements in his job description about the job that the health director is doing is the format by Durham County HR. But we'll get you a quick look at it before it goes out and a chance to comment before it goes out. Is that okay, Eric?
Yes, sir.
Okay, thank you.
Thank you.
Moving on to old business, you got a series of policy reviews in your packet. There are 8 of them. Most of them are grammatical changes, updates, deletions of references at the end of the each policy that don't apply or don't exist anymore. So this is more just a cleanup than a really rewrite. And I would propose that we approve these as rewritten and received in your packet. But let's have a discussion on that before I get too far ahead of us. And we can discuss any or all of these that you want to discuss.
Well, Steve, as you said, it seemed that the only changes have been grammatical in nature and updates to things that have been removed or either added to the policies. So I would think unless someone has some concerns about all or one of the policies, that we just vote to approve them as a bundle.
Okay, so I have a motion to approve them as a bundle.
I make a motion.
Okay, Dr. Miller, I have him as a second. Any further discussion?
Nope.
Okay, well, let's do the roll call vote. Dr. Braithwaite,
Yes.
Mr. Brown,
Yes.
Mr. Curtis,
Yes.
Commissioner Howardin,
Yes.
Mr. Ireland,
Yes.
Dr. Jackson,
Yes.
Dr. McDougall, Dr. Miller,
Yes.
Ms. Orto,
Yes.
Dr. Rosenstein,
Yes.
and Mr. Diedrich, yes. So thank you. Those are approved. Next on the agenda is a change in the Bull City United program. And I've asked Rod to give us an update on changes with that program.
Thank you, Mr. Chair. Just a brief update for the Board of Health. The first week of September, I did receive notification from General Manager Joanne Pierce that it was the intention of the county manager to kind of have Bull City United and Project Build to kind of go into a different direction as far as their leadership. I was told it's no reflection on how we're currently doing. It's more of a vision that he has for the beginning of next year, to where he wants Bull City United, Project Build, and the program My Brother's Keeper to all be under one umbrella and possibly be under the leadership of some different coordinator. So I did have that conversation with General Manager Pierce, and then that was followed up by a telephone conversation with the county manager himself, wanting to make that effective immediately on, I believe it was September the 3rd. So it was requested of me to send an email to all those individuals who are a part of those programs. And the agreement that we landed on was, considering the fact that we are in the middle of a budget season, their budgets would still be managed by public health. We would still take care of all their fiduciary responsibilities. However, the people management, personnel management would fall under General Manager Joanne Pierce. I did want to let the Board of Health know about this change. And additionally, you should also know that they are still housed in the Department of Public Health. They've not moved. And we still consider them to be our partners, our teammates. And we owe a debt of gratitude to both of these units because they were instrumental during our COVID response, from screening to food delivery to going to their target areas where they normally work and passing out flyers and educational materials. So we are certainly missing this great portion of our team. However, we are being obedient to the county manager's vision. I'd be happy to answer any questions you may have.
So will they continue to be housed in the health department, Rod?
Going forward, Dr. Jackson, to be determined. I've not received word as to whether or not their location is going to change, but they have been working or doing a lot of work virtually. And given the current state of affairs with crimes and shootings, you know, it's important work that needs to be done, and we support their efforts. So to answer your question, I'm not exactly sure at this time.
Any other questions? Okay, thank you, Ron. So we'll move on to new business. We had no agenda items here under new business except agenda items we want on the December agenda. So let me ask if any of you have items you'd like to place on the agenda for December. Okay, thank you.
If we think of something, we'll submit it. I can't think of anything right now. There must be something to round out this 2020 year.
That's what I was thinking the same thing, but I can't think of it now.
Well, just send anything you come up with to Roz.
Okay.
She'll forward it to Rod and I. Thank you.
Okay.
Any informal discussion?
No, I just want to continue to say to the health department and all the staff that we so appreciate all of the work and want them to continue to please be safe, to take care of their health and well-being, because this virus has not gone away.
Yeah.
Thank you, Commissioner Howerton. I'll be more than happy to pass that word on to the staff.
Right. And I'm sure we all echo that. They've been great, so.
We do very much so. So please let them know how much the board supports them. Any other discussion? We're about to set a land speed record here.
I know.
It's not even 6 o'clock yet. Wow.
Barely 5:30.
I got to start talking more.
You
make the meeting, so make the meeting longer, you know?
Okay, one more chance for informal discussion before the motion to adjourn.
I just wanted to say something to make sure that everybody new to our team really feels welcomed. And I think it's great that they decided to join us. So we appreciate you joining the team. So And again, I think everybody's just overwhelmed at what a great job the health department has done during this time that we've never seen like before. So, and Rod, boy, did you step into it.
I heard a quote. I heard a quote from Billie Jean King. I think she said, "The pressure is a privilege."
There you go.
That's a good way to look at it.
Yeah.
Yeah.
Well, we definitely think we made the right choice. So thank you.
You know, just to say that as the president of the state association, my year, there was no floods, there was no tornadoes, there was no viruses. And the year before, there were floods and fires. And the year after, it's been pandemics and floods. So it must be something that I just kind of got out of it.
Well, good job, Brenda.
Yeah.
And Josh, you look familiar. Did I see you in a recent meeting?
Just the one we had back in August, I believe.
Yeah.
I'm fairly new to the board. It's been about.
Okay. You're not on you don't work with hepatitis.
I do not.
Okay.
And welcome to the board, Josh. I think we couldn't see you when you're on your first meeting here.
Right, yeah.
So now we can see.
Good to see you. Welcome.
Welcome, yeah.
Happy to be here.
I don't think I've seen Dr. McDougall either till today.
Yeah, he was a guest.
I've been here. I've been here.
Yeah, when you were a guest, but I don't think I've seen you since.
Yeah, I was on the, I want to say it was June or May.
Yeah, he was at one meeting, I remember.
I've been at every meeting. I've just been quiet the last couple of meetings.
Oh, is that what it is? Okay.
Okay, any other informal discussion? And I would entertain a motion to adjourn.
So moved.
Second.
Curtis, so moved.
All right, moved and second, and let me do the roll call vote. Dr. Braithwaite?
Yes.
Mr. Brown?
Yes.
Mr. Curtis?
Yes.
Commissioner Howard?
Yes.
Mr. Ireland?
Yes.
Dr. Jackson?
Yes.
Dr. McDougall?
Yes.
Dr. Miller?
Yes.
Ms. Orto?
Yes.
Dr. Rosenstein?
Yes.
And Mr. Dietrich, yes. So
Yes.
we stand adjourned and we will see you again in December.
Thank you.
All right.
Thank you.
Thank you.
Bye, everybody.
Bye, everybody.
Bye-bye.
Bye.